Dr Angela Jackson is a health economist who has worked at the highest levels in government, beginning as an economist with the Department of the Prime Minister and Cabinet, and then as a Deputy Chief of Staff to the then Finance Minister, Lindsay Tanner. Angela was responsible for providing policy advice across fiscal policy and all areas of social policy, including national health reform. Now, Angela was also the lead economist at Equity Economics, authoring a number of reports on health, aged care, disability, housing, and gender policy. Hi, Angela. That's quite an impressive resume.
Thanks a lot. It's always, it's probably my least favourite part of these things, actually, because you get a bit like, oh.
Very impressive. I wish I had half the qualifications as you did. And I'm sorry for the background. We're at home with COVID, but thanks to the wonderful technology, it's able to go ahead.
Yeah, great. Thanks, Michael. And look, I'm at home too. That's where I'm working at the moment. So the new normal.
Great. So what's your take on the budget? Because it appears that the federal budget is aimed almost purely on buying votes. Is that your take as well, Angela?
Oh, look, it's probably a little bit unfair, but it's certainly a pre-election budget, probably at a time when our economy doesn't need one. Huge amount of new spending, $40 billion. And look, as you allude to, a lot of it is focused on lifting some of those cost of living pressures, but really just in the short term. So not necessarily doing anything long-term and structural to really, I guess, drive economic growth and to take some of the pressure that families are facing. It's a bit disappointing. And I think overall, if we look at the whole COVID response, while it's been good in terms of supporting the economy and supporting people through a tough period, it hasn't really had that long-term focus about, well, how do we build, a country for the future where we can all prosper? And that's disappointing, I think, when you look at the scale of spending and then the scale of debt that we're now facing.
And also when you consider the scale of the structural problems that COVID has actually exposed more than created, it's actually brought them more to the fore, if anything. Would you agree with that, Angela?
Yeah, look, I think definitely. I think we really saw what insecure work means for people. People lost their jobs in just huge numbers, and they were mainly people in casual work. We saw the impact as well, in the aged care workforce about working multiple jobs across multiple sites and how that just exacerbated, particularly here in Victoria, the spread of COVID-19 through 2020 and 2021. There's no doubt that, yes, COVID has exposed a lot of those inequalities. And even if you look at the death rates about who died and who didn't die through COVID, 3 times the number of people in the lowest socioeconomic groups and the highest, it just exposed and showed us how, inequality in our society is impacting us day in, day out. But with such a big shock, it really brought those inequities to the fore.
Now, as a health economist, this is right up your alley. Is the lack of funding for GPs for the primary care and all of the money seemingly going to hospital funding, or the focus being on hospital funding, are they missing the point here? Are we better aimed at keeping people out of hospitals by funding primary care better?
Yeah, look, I think it's a really interesting part of healthcare and like how we fund healthcare. It's certainly true. You want to keep people out of hospital, right? No one likes going to hospital. It's not something that's enjoyable, and it's certainly something that's quite expensive for our health system. What we tend to do is, in terms of complex chronic care in particular, we just don't have the right funding mechanisms in place. Yes, GPs are an important part of that and increasing that primary care sector. But the other side of it is also how that interacts with specialist chronic disease management. And the current way that we fund things and what we prioritise just doesn't support people, particularly with those complex conditions, which can be quite difficult to manage, to stay healthy and to stay out of hospital. And that means poorer health outcomes, obviously, which is, ultimately what we're about, but it also means higher costs in terms of hospital costs and people not being able to work as much and participate as much in the economy. So yes, we do need, I think, a system much more focused on keeping people out of hospital and looking at how we fund that chronic disease management in particular in the community is one thing that the government simply hasn't done part of this process and as part of the reforms and as part of the budget. And it'd be good to see reform in that space.
Now, we haven't actually heard the reply or the response to the budget as yet from Albanese. What do you think they should respond to? What's their point of difference be?
Yeah, it's really interesting. So it's always difficult in an election year for oppositions to create too much difference. There's that small target strategy, which has obviously been very much part of the Labor Party's strategies, especially since they lost in 2019 with what some people would say was too big an agenda for people to sort of consume and to take in. I think tonight it would be really good to have much more of that long-term focus around reform. So thinking about the areas where we can actually drive economic growth into the future and drive a more equitable Australia as well. So some of my priorities would be around taxation. So thinking about how we tax wealth versus income in Australia. We really don't tax wealth much at all, and we tax income a lot. And what that means is for income earners, you're paying a lot more of your day-to-day pay packet in tax than in other countries. And we could look at shifting that and creating more incentives to work and supporting families with those cost of living pressures. The other area is the care economy, of course. And, if one thing COVID taught us, it was that it's very difficult to work when you're looking after children or looking after elderly parents. So investing in that care economy with higher wages, more access to quality services can really drive participation across the economy, because you can't care and work at the same time. And, at the moment in Australia, we really underinvest. And so for a lot of people, they can't even access childcare. Like recent, statistics, over 1 million of us live in an area with no childcare at all. And so if you're a mum or a dad looking to work and you can't find anywhere for your kid to be looked after, well, you just can't work. And so there's just reforms in those spaces and investments that would be really good to see. And, that sort of more long-term vision for where Australia is going. We've learnt a lot of lessons from COVID-19 individually, and I think as a society, and it'd be great to see some of those lessons reflected in the policies of government and where they're investing.
Now, while I've got you on the care aspect of it, the tinkering with the shared parental leave scheme actually seems to be an own goal, where they've now made the dad and partner pay, which I hate the name of it because it already makes assumptions, but where there's not 2 weeks reserved for dads, and we've already seen as little as 1 or 2% of dads taking up that small amount available to them. Now that they don't have that reserved for them and 20 weeks being made available, is this going to further exacerbate the problem and entrench even more mums doing the lion's share of the caring with all 20 weeks available to her?
Yeah, look, Michael, I know this is an issue really dear to your heart, and your advocacy in this space is just fantastic. We need dads more involved. I mean, it's beneficial for kids, particularly. More involved fathers is one of the best predictors of child outcomes. So we want to be supporting dads, particularly in those early days, to gain those caring skills, because they are skills. It's not something that comes naturally to any of us. It's when we, if you remember those first days when you get the baby home and you look at your partner and you go, what are we going to do? And, there's almost that disbelief, to be honest with you. I remember walking out with my daughter and thinking, I can't believe they're letting us take her home. We've got no idea what we're doing. But what we do is we support mums to gain those caring skills and not dads. And that does a disservice to fathers and their role in the family. But it also means for women, they do get locked into that unpaid caring role. They gain those skills, which is great, but it means they tend to then carry on doing all that unpaid caring work. That means they're not in paid work. And we can see internationally when you have these use it or lose it schemes, so you have some of the leave that's just quarantined for dads to get those skills, it takes away some of the, I guess, the social pressure of not taking that leave. It makes it a norm, like this is what you should do and this is what all dads should do. And you see a real increase in uptake. And that benefits dads. That bonding time with young kids is great. It improves your relationships with your kids, which is probably one of the most important parts of your life. It also leads to women being more likely to go back to work and earning more money. And it improves, obviously, kids' outcomes in the long term too. So it's really disappointing. And I think it just shows they don't quite understand the dynamics of that family decision making. They're really hard decisions that, families have to make about who works and who cares. And there's a lot of different factors at play, including, that women are often in lower paid jobs than men, and those social norms. To get over some of those things, we really need to support dads to take that time off. And it's really disappointing that the government hasn't, while there are some elements of this reform that are good, like allowing dads to take more leave if they want to. We know that to get this sort of change, we need to have some time that's just quarantined for dads.
Now, with the caring economy as well, I'm not an expert, far from it, which will become obvious the more that I speak. But this trickle down, so the top-down approach with a lot of our incentives and taxation things, surely if we had have just upped the pay, for the caring sector, for those in aged care and everything, that money would have flowed straight back into the economy, wouldn't it?
Yeah, so obviously these are generally lower paid workers. So what we know is that they're more likely to spend the money than to save it. So certainly what you find is if you give a pay increase to a low paid person, then it has that multiplier effect through the economy. So that's beneficial. It's also true that it's really hard to find aged care and childcare staff. So, there's a lot of childcare operators at the moment who are operating outside the, minimum requirements of staffing because they simply can't find the workers. And so we do need to support the sector to attract those workers and to retain those workers because, quality in this sector is also really, really important. And whether it's aged care or childcare, having skilled workers with more experience who are committed to the industry is far better than having this constant churn and turnover of just, younger staff coming through and then going, actually, I can't afford to work in this sector, even though I'm really committed to it. And then leaving the sector and having to retrain all the time. And that quality aspect of it as well is really important. So we certainly, when you're in a situation where, an aged care worker earns less than working at Bunnings, I think you really have to evaluate what your priorities are. They're doing some of the most important work with some of the most vulnerable people in our community. It's hard work, it's multi-skilled, and yet they're getting paid, peanuts, to be honest with you, and not enough to cover basic cost of living, in terms of rents, even now as rents have been rising, across Australia and some regional areas as well.
With your economist hat on, with all of your fancy formulas that you use, can a care sector ever be for profit? Are the two a dichotomy that just doesn't mix?
As an economist, I think they can, but I think the market and the way you structure the market is really, really important. So it is one problem, I think, in Australia in particular with all our what we call quasi markets, because they're effectively, government underpins them. So they're not, pure markets, is we haven't structured them very well at all. And so we have competition and we have private providers, but the incentives aren't there for them to provide those high quality services. And so what you tend to see, and what we certainly see in Australia, is that you then get higher costs and lower quality. And so we really do need to be thinking, I think, across the board in terms of reforms about how we've set up these quasi markets to get the incentives right. So they're competing on quality, not price. And so that the incentives are there for them to provide those high quality services, because the private sector isn't bad necessarily, and certainly probably can provide services that government simply couldn't provide and wouldn't have the capabilities to provide. But you need to set the market up properly. And at the moment, they're not set up properly. And whether we talk about the NDIS, aged care, childcare, the job network, you have just seen, market after market where quality has suffered, profits are high. And I think the taxpayer is rightly probably left going, well, what are we paying for here? And, we don't really want to be paying for super yachts for aged care providers when quality is so low. But you need to set your markets up properly.
What part do we play as consumers? Because I know at one stage I was paying more in childcare per month than my mortgage. What part do we play as consumers wanting it for free? How do we jump that chasm between we want it cheap or we want it free, but we want it provided with quality?
It's really hard. I remember when I first, was also looking for childcare places, and you sort of ask, well, how do you, find out about quality? And I got told you just go on your gut. And I can remember thinking that's not the best. I mean, maybe it's a good one. And certainly when you go into some childcare centres, you go, I don't want my kid in here. And you go to other ones and you think, oh no, this feels safe and secure. But certainly not going off your gut. I think it's important to look at, there are some quality indicators out there in childcare and aged care. They're not great and they're not easy, but look at those. So really think about, am I getting a quality service here? And what are the things that I'm looking for? Ask questions. Ultimately, we want the market to reward those high quality providers because that incentivizes them to provide that quality. Yes, you have to, in some ways, pay for it, but it's not really, and this is the problem with the market. How much would you pay for quality childcare for your kid, right? It's kind of infinite, right? You're prepared to pay what you have to pay to get that service because it's your kid and you want them to have quality care and safe care. But the price being the factor can sometimes distort that market. So really focus on the quality of what you're getting and to make sure that you're getting a quality service, and things that I look for, as my tips were staff turnover. So if staff turnover is low, that probably means it's a good place to work. That probably means their systems are pretty good. So things like that, I think, can be a really good indicator of whether you're getting a quality service or not.
Great. Now, the cost of this election is going to be high with them. The Libs cutting taxes by about $30 billion over 5 years and spending more. Is this going to drag us backwards, or is now the time to actually spend that money while interest rates are historically low?
Yeah, so there's obviously, and I think you're alluding to the tax cuts, the stage 3 tax cuts, which predominantly benefit high income earners and predominantly benefit men, sort of $2 to every dollar that they benefit women. They're not affordable right now. That's the reality. We are in debt. We're in deep debt. And the economics of providing those tax cuts is pretty dubious in terms of the benefit long term. So I think, and particularly when it's not tied to other tax reforms that really underpin the services we need. So it's not necessarily a time of austerity, but I think it's a time where it would be good to see greater responsibility and high quality spending. There's a lot of talk in Australia about debt and deficit. The numbers themselves, do we need to be that worried about? Probably not, but where the money's going is actually really important. And if it's going towards things that, improve the well-being of Australia and our productive capacity, our ability to grow, well, then a big tick. But if it's just going to, which this budget generally is, short-term giveaways and money that isn't associated with, higher growth, then it's a big cross, right? Because it's just spending money that we don't have on something that's not going to produce much value. So look, it is a bad time for our economy, I think, to be having an election. We have low unemployment, which is a great thing coming out of the pandemic. We've got relatively strong growth. So the economy's, demand's up, the economy is going pretty well, but we have got, supply side shortages, high oil prices, cost of living pressures. And that means the Reserve Bank is going to have to respond at some point. And what the government's, economic agenda is going to do is probably add to those inflationary pressures in the short term without lifting that productive capacity of the economy. So the timing's not great from an economist's perspective. And it would be good to see a bit more restraint, I think, from both sides of politics going into this election.
How do we explain the share market, the stock market at record highs, company profits at record highs, yet no real wage growth? How do we address that? And will this budget further impact it or alleviate it?
Yeah, it's an interesting question, and it's an important one that really impacts a lot of families because wages just haven't been going up in Australia over the last 10 or so years. The reality is there's obviously a lot of factors at play with the labour market. It's not like it's one thing that's caused low wages. But yes, in this budget, for example, the government didn't lift its wage cap on public sector wages, which I think is keeping wage increases at around 1%. That obviously has an impact. The Commonwealth is a huge employer, and if they're not increasing wages, well, then why would anyone else? And there's not that competition for other employers to also increase wages. So that's one thing they could have done in this budget. The other is how we set wages in this country. It's quite rigid. It's moved away from enterprise bargaining, which used to really deliver quite healthy wage increases and productivity improvements at the workplace level. So there is a need, I think, to really, and then you have the issue around insecure work and casual work, which is, I guess, lowered the power of workers in terms of those negotiations. It's sort of one thing to negotiate a higher pay when you're a permanent employee and you've got a lot of track record in a company. But if you're a casual or gig worker, you're expendable, right? And so for the employer, there's not the same imperative to provide that wage increase. So we really need to look at the whole structure of the labour market, about how we regulate it and how we set wages in this country to try and make sure that we're delivering wage increases, not huge ones, but just ones that allow people to keep up with the cost of living, that give workers that share of productivity improvements, so it's not all just going to company profits. And that really requires, I think, businesses and unions and the political masses of the day, and probably on both sides of politics, to really sit down and go, gee, this labour market's not delivering. It's not delivering for our economy. It's not delivering for workers or businesses. What can we do to reform it and modernise it so that we can provide, the flexibility that businesses want, but the protection workers need, and have healthy wages growth that the economy needs?
I think one of the under-recognised or under-focused on parts of the Australian economy is small business, with small business accounting for over 90%, I think it is, of all economic things. I know here in Victoria, it's over 600,000 small businesses, and over 60% of those are non-employing everyone. So it's Joe with his lawn mowing round, Sally with a hairdressing studio at home, the couple that run their cafe, all of these things. There's not a lot in this budget apart from the digitisation. Is that a missed opportunity, do you think, Angela?
Yeah, look, I mean, they did sort of tick the small business box with a few additional tax breaks, and they've obviously lowered the tax rate that small businesses face to 25%, which is beneficial. But you're right, small businesses are really important, and they're an important part of the economy. And I think those labour market issues go back to small businesses as well. They're managing a lot of the risk of employing people. And so if they do take someone on permanently, there can be a lot of risks associated with that, whether it's, sick leave, paid parental leave, which we've discussed, whether or not hours are right. So, can I adjust the hours of this permanent employee or not? They're managing a lot of risks at the moment, which is why a lot of them then rely on casual workers. And that creates insecure work, which means, the consumers in the economy don't have that certainty over their pay packets the next week. If they get sick, what happens, all those sort of things. And so I think the budget probably missed an opportunity, and one of the big reforms I would like to see, and it is fairly, maybe too big for the Australian psyche to get its head around, is if we could have a system of social insurance in this country where everybody and every worker had basic entitlements guaranteed by the government. Obviously that means higher taxation, but it means lower costs for all businesses. You could really underpin, I think, much more flexibility for businesses, including small businesses, in terms of those hours of work, because, if they changed the hours of work of their employees, for example, because of changed business conditions, those employees could then get money to compensate for that loss of income over a period of time. So you could have that adjustment mechanism built in. I think it's some of those bigger reforms that we really need to think about, that's more fit for purpose for the way in which the economy has changed, where it does require, in some sense, that greater flexibility, but you need to have the security for people underpinning that. Otherwise, people can't plan, and they can't pay their mortgage or their rent or anything else, or their food bills week to week. So, but there are models that work, and there are models that other economies have, trialed and show that work and can underpin a really prosperous, more equal society.
How do we cross that divide here in Australia? We see countries with a higher taxation rate and a lot better services and public infrastructure. Here in Australia, there just doesn't seem to be an appetite, because we've been sold the line of lower tax, lower tax, lower tax, without the realisation, well, it's got to come from somewhere. They take with one hand and give back with the other.
I think it's about linking it to what the benefits are. So I think we've seen, for example, in Australia, the NDIS, there was widespread support for an increase in taxation to cover that, oh, okay, we're going to have this insurance scheme. So if I become disabled or a family member becomes disabled or has a disability, then they're going to be covered, and I will pay extra for that cover. So I think it's about linking it to what the benefits are. I think often we don't like paying more taxes because it's just, oh, well, my money's being wasted. But I think particularly for big reforms, I think the Australian population probably is more willing and open when they can see that strong connection between the extra taxes they're paying and the services they're going to get, to step up and to say, yeah, look, that makes sense. I'm going to be better off because there is this, this provision or this security there than I would have been just by having lower taxation.
Now, one of the things I was impressed with, being from regional areas myself, was the 1.3 billion broadband improvement, the phone dropout. Where it's going yet hasn't been announced. So whether it's going to go to marginal seats or to shore up votes is the next one. How much of this needs to be improved? Because we really do have a two-tier society, as you said, when there are childcare places in Australia where you just can't get them. How much does this need to be a feature of future budgets as well?
Yeah, I think it's, and we've sort of, again, in Australia had a really, I guess, hands-off approach in terms of regional development and the development of other cities and other, I guess, where people are living and in regional areas. And that's about transport, and it's about infrastructure, and it's about, if you put the fast train in, people will generally move to the end of it, right? Like you can see that across time, whereas we haven't invested in that infrastructure. So I think it's a good thing. I think you're right to flag that it's probably going to be marginal seats. I unfortunately live in Josh Frydenberg's seat, and we have absolutely shocking mobile phone coverage. Like, it's unbelievably bad. I'm near the CBD of, within 7 Ks of Melbourne CBD, and the number of black spots in this space. But, I'm in a safe Liberal seat, so, forget about it, basically.
Yep.
And it is also a problem in terms of infrastructure investment that it has been so politicised in Australia that you see some regions, I come from Tasmania, and you go to the northeast, and it is beautiful roads everywhere with no one on them, and then you go to Hobart, where, major capital, and it's really struggling, and you don't have a major dual carriageway between the two capital or the two major cities of Launceston and Hobart, and it's just so stark when you look at the difference in investment between the marginal seats and the safe seats. That really needs to change. And I think the Integrity Commission nationally could maybe help drive some of those changes with a few more checks and balances, because it doesn't do anyone really any good if the investment's driven by, who holds the seat and whether it's safe or not, rather than what's the economic imperative here.
Yeah, it would be great to see the Auditor General actually on the supply side of things. So, he's the one writing the check. So this is what we want, and he has to approve it rather than checking it once it's been spent, I think.
Yeah, that's right. Well, yeah, it's an interesting idea. I mean, it might slow things down a bit, but yeah, look, I think, often people will respond to the incentive of knowing that there's going to be a review there. And, certainly the politics around the pork barrelling is a lot more toxic than perhaps it was previously. But, it's public money ultimately, and it should be spent in the best public interest, not in the best political interest.
Yeah. All right, Angela Jackson, thanks so much for your time. And
thank you for having me, Michael.
Hopefully we'll talk to you afterwards and see what the response has been like.
Okay, great. Thanks, Michael. Have a great day.